lovely to meet you. I am Kirsty and I am presenting to you my application for the 28 Day Smile. Firstly, I'd like to take this opportunity to thank you all for going through my application and giving me a little bit of your valued time to see whether the 28 Day Smile is worthy of winning this award. So what is the 28 Day Smile? The idea of the 28 Day Smile came to me because I just thought patients need to know this stuff. I spent over 5 years at university learning how to look after people's smile. What I've realised in over my decade of experience is that patients, there's no good, you can come to me and I can clean your teeth, I can remove all of the plaque and calculus and staining that's built up, and then you'll leave and then you can come back 3, 6, 12 months later and I'm just going to remove all of that again. Whilst that's happening over a number of years, your gums are not going to take all of that bacteria lying on them for that amount of time, and disease will start to kick in. And we do know from research that the bacteria that's lying along your gum line can get into your bloodstream, it can get into your body, and it can be linked to all sorts of nasty systemic diseases. People do need to know about this. But I think the best way for me to explain what the 28 Day Smile is to give you a little taste of what it actually is to join the 28 Day Smile. Tip number 1 is to, when you're brushing your teeth, time yourself. A lot of people are messaging me and they come in the surgery and they're like, Kirsty, how do I get my teeth whiter? How do I get fresher breath? And they're brushing once a day for 37 seconds is the average toothbrushing time in the UK. That really does need to be increased if we're going to up our game and have fresh breath and prevent gum disease and all the other diseases that relate to gum disease. So time yourself toothbrushing. That's tip number 1. Tip number 2 is to make sure that when you're brushing your teeth is to seal your lips around your toothbrush. This is great because it allows you to go right back here and into the hard to reach areas to brush along your gum line, and also it stops your bathroom cabinet from getting splattered in toothpaste residue, which is not great. Tip number 3 is once you've brushed your teeth, spit out and leave it. Don't rinse with any water, no mouthwash. Leave the toothpaste to carry on working. You're paying quite a little bit for toothpaste. It's not the cheapest stuff. And you don't want it, it's not going to work. It's not going to do the full job of protecting your smile if you rinse all of that residue away. So for anyone 6 and above, you need to make sure that you're brushing your teeth, spitting out and leaving it. Leave that last little film. It'll create like a nice little bubble, a nice little protective film along your tooth surface, and any bacteria will just be pushed away for a little bit. It does protect your smile for quite a long time, so that's definitely worth trying. It can really help patients with sensitivity. It's my number 1 tip for patients with sensitivity. I ask them if they rinse after brushing and they're like, yeah, I rinse with water or mouthwash, and I'm like, just try not to. You can also take a little bit of toothpaste and rub it on anywhere that's sensitive. Okay, so I'm giving you more tips, but this is it's just showing you how much there is to learn about toothbrushing. And I feel in the dental surgery we often don't get enough time to really give patients all of this advice. And also patients can they can be a bit defensive. Like, no one wants to be judged on their ability to brush their teeth because it's seen as such a basic life skill. But yeah, I recently took up triathlon and I learned to swim when I was a child, and I recently learned in the last few years that I was not learning how to swim. So triathlon, give it a go. But yeah, it's just showing that there are things that we feel like we know how to do, but that's not always the case, evidently, because when patients come into the surgery, they're quite happy for me to clean their teeth, and I can see the evidence of their ability to maybe not brush their teeth so well. But when then we sort of broach the subject of toothbrushing and I get my demonstration toothbrush out and I ask patients to demonstrate to me how they brush their teeth, they're a bit unsure and they're like, well, I don't, do I really need to do this? I can brush your teeth and I can clean your teeth every 3 months, every 6 months, however often you decide to come to visit me. But it's the time in between that really needs addressing. And I feel with a better understanding of what actually toothbrushing is doing, patients will be more motivated to take on that challenge and to be like, yeah, I want to learn about toothbrushing. Why do I not know about this? And again, like I said, with the increase of systemic diseases, I really do think that it's really difficult to put into like a couple of minutes the whole ambition that I have with a 28-day smile. But if you have any other questions, or if you want to know any bit more, if I can answer anything else, then yeah, please contact me. And yeah, thank you very much for taking the time to watch this video. I really do appreciate it. I hope you've enjoyed, and yeah, keep brushing.